I can see that the list of participants, we have a few more new faces and a number of us who are at the course during module 1. And I think in my second slide, we will have a chance to speak, then we can get to know who is on the call today. But just to start off with a bit of an introduction. So welcome to today, and to give you a bit of a recap of what we did last week. We went through the objectives of the course, and like you have heard me mentioning, the objective is to support you to develop a vital statistics report, and we are hoping that by the end of the last module of this course, you will be able to have a draft that you can work towards finalizing. And last week we went through different sources of data, and we introduced to you what civil registration is. We talked about vital statistics. We talked about civil registration being recognized by the UN as the most ideal source of vital statistics. And then we also ran through the different modules of the course, and we gave you an assignment, which was to go and make sure that you have your data set that you will be analyzing ready for the course. And we asked you to ensure that your data set is organized in the right format. That is, you have it in a format that is analyzable, one record per row, one variable per column, and ensuring that all the variables are in place. And thank you so much, because we saw some of you did send across your data sets for us to look at and advise if there are any gaps, and we were able to share that feedback. So thank you for the effort you've put up in helping to keep up with the course so far. So today, which is module 2, we will be picking up from there and revisiting where we left off, which was, we talked about sources of vital statistics, and we said there are several sources of vital statistics. We introduced to you civil registration as a source of vital statistics. We talked a bit about health systems are also a source of vital statistics. We also said that vital statistics can be collected through censuses and surveys and other formats. In other formats, which is not in the administrative collection kind of way. So here we are saying that the analysis that we will be doing through this course is leading towards the production of a vital statistics report, and we are looking at birth and death data. We are looking at data on births and deaths, basically live births and deaths that are collected by the Civil Registration Office and or the Ministry of Health. And here we mean that you can analyze both your civil registration and your Ministry of Health data, but ideally we would really be pleased if you're able to analyze your civil registration data. So we will have that data being used to tabulate. We will be able to tabulate that data to see how your birth and death records look like by different age groups, by different socioeconomic variables, and then we will also compute some key indicators of fertility and mortality based on those data sets. And then we will need the census to provide us with a denominator data set, which we will use for computation of the indicators. And if you do not have a very recent census, we will use some national or internationally produced population projections for our denominator data source. So here the emphasis is just that we'll be using the numerator data, which is sourced from either your civil registration or your health system or both. And we will also be needing denominator data, which can be from your census or from some population projections. So that leads me to the next slide, which is to talk to you and just to go around and see what data did you bring to your course, and where is it sourced from, and which years does it cover? And this is just to give each of you an opportunity to tell us about the data that you will be analyzing. So if you don't mind, I will call out country names based on the persons I'm seeing on the line. And maybe we can start off with Palau. Palau, if you don't mind taking the floor to tell us which data do you have, where does it come from, and which years does it cover?
Okay, for the civil registry, I have data from the civil registry, and it's births and deaths. It has the names, the birth dates, where they were born, and names of parents.
And which years does the data cover?
Oh, sorry, 2016 to 2019, 2020.
Right. Okay, cool. And do we have someone else from Palau on the line, or is that the data set that you will be working on?
So we haven't merged. We discussed merging our data sets. We have not done that yet, and that's why I was asking you the questions this morning. I believe that was the plan going forward, is we would merge our data sets.
Okay. Okay, then let's talk about, let's go to the other country and then we can come back to you, Alison, and see your plans for data merging and see whether there's a way we can contribute to that discussion.
Okay.
Okay, so Kiribati.
Hello, hello everyone.
Hello.
You guys can hear me, right?
Yes.
Yeah, as Gloria, I think Mendere already sent you the date to the avatar on the date. Yeah, I think so. But she have both of the date and the birth, but I think now we both on leave, so she's supposed to be online from her own and myself from here, but I think maybe she's on her way, or she's not sure if she's having or but she already done it.
Yes.
She says yeah with it.
Yes, that's true. We received, we saw the data set from Kiribati.
Okay, thanks.
Okay. Samoa, do we have someone from Samoa? Anyone from Samoa? Tupai, can you hear us? Okay, then we can move to RMI.
Yeah, we're from RMI.
Hello. Okay, we are just talking about the data that we will be analyzing. And do you have your data set with you already?
Yes, I do have the data set right with me.
Okay. And is it from the Ministry of Health or from civil registration?
It is from the Ministry of Health. I couldn't get the data from the civil registration. They don't have any database, and I don't think they have the data right now with them. So the only data we have is from the Ministry of Health.
Okay, thank you. Thank you, Hamon. And which years of data? Which year?
It is from 2016 up to 2020.
Okay, good, perfect. And then Samoa says, I saw a comment from Samoa. They're waiting for the data from National Health. But do you have data from your civil registry, Samoa? Okay, then let's go to Vanuatu. Anyone from Vanuatu? Okay, well, it looks like we don't have anyone from Vanuatu. So yeah, the purpose of that exercise is basically for us to just have an understanding of what data you will be analyzing from your side, and we're happy to to discuss further with you about how you want to take on that exercise, whether you will be analyzing 2 data sets or you will arrive at 1 data set. We're happy to take that forward, including with you, Alison. So just to continue on, today we are covering a session that focuses on data quality. And okay, Vanuatu, we've noted your comment, and thank you for confirming with us that you're here. Okay, so yes, so the session today is focusing on data quality, and we want to make sure that the data that we are analyzing is in good quality. And why this is important is because if we analyze data that is of poor quality, certainly the analysis will lead to poor findings, and the decisions that are supposed to be made from that data will be decisions that are not guided properly. And we also say that when you're talking about data quality, there are very many angles to look at it. You can think about its reliability, its accuracy, its completeness, its timeliness, its relevance, its consistency. There are very many angles to which data quality can be looked at. But in general, we want to underline that if we have poor data, we will mislead our governments in terms of the decisions that are supposed to be made from this kind of data, because data, like we saw last time, is supposed to support us to develop policies that can be used to support development efforts. So in a nutshell, we need to establish trust in our data. We need to make sure that the data we're analyzing is of the best quality possible. And this does not mean that the data needs to be perfect. We know that sometimes that data can have inconsistencies that cannot be addressed completely. However, we need to be sure that those limitations in the data are well documented, so that when you come up with your report, if there's any particular limitation that your data has, you need to explicitly share it with your readers so that your data or your findings are not misinterpreted. So we need to make sure that we are honest about the limitations of our data. Then on to the next slide. When we talk about data quality, there are 2 aspects to it. We need to look at data quality continually. So as you maintain your records, it is important once in a while to stop and review the data that you're collecting to make sure that it's accurate, that it's complete, it's timely, it's unbiased. And that is a continual exercise. You can decide to do it either at a let's say annually, or maybe every 6 months, or every month. You can stop and look at the data that has been collected by your department and just make sure that any data quality issues are addressed. However, at this stage right now, we are at the stage of analyzing the data. So we will be looking at the data again at individual level. We'll be looking at individual records to make sure that they don't have anomalies to the extent that we can adjust. We will adjust them. And then we will also review tabulated data. We can calculate some indicators and compare them across international sources to help us know whether we are too off what is expected. Because there's a particular range within which the analysis would be what's the word? If you compute a particular indicator and it's completely off what is the situation regionally or internationally, then you might have some questions as to whether is this really accurate, or could there be a problem with my data. So we will be looking at these quality assessment measures from these different angles. And then when we talk about data cleaning, there are a few steps that we've outlined here, and which we will be discussing in detail through the next presenters. So first of all, we need to set up our unit record data. Like we gave you an assignment last week, we want to ensure that all the data fields are included and that all the records have been carried into a working spreadsheet. So the first thing we want to underline here is that we don't want you to analyze your master copy data. We don't want you to analyze the only copy of data that is existent in your country. Rather, we would advise you to copy that data into another working file, so that in case there are any problems, you have not messed up with your original master copy data set. So that is very important. Don't work on the original country data set, copy it into a separate working file. And then the other issue we'll be looking at is removal of duplicates, which is very common, especially with civil registration data. We will talk to you about how do you identify duplicates and how can you go about removing them. And then we will also make sure that we exclude irrelevant data. And in this case, when we are analyzing a birth data set, which will be the one that we will begin with, we will be sure to ensure that it excludes stillbirths. So all the stillbirths, you would copy them from your live birth data and put them into a separate worksheet because they will not be analyzed in combination with the live birth data set. And then the other aspect is to make sure that there are consistent variable names and data labels. So sometimes you might see in your data, some columns might not have a proper column name. So if it's in the head of every row, we need to have very clear variable names. And even within your data set, the way you've labeled your variable name, sometimes if it's males, you might see your database has M, F, and sometimes there's male, female. Sometimes you might be having different ways in which that is recorded. So the idea is to systematize the labeling of all variables and all records so that we ensure that the output of the analysis is consistent. And then you might also observe that in some of your data sets, there are missing values and use of, and we will work towards seeing, for instance, does the health data set have data that you can use to complement your civil registry data so that you fill up a particular missing value. For instance, if the age of mother does not exist, can you be able to get it from another data source? So one very important tip to keep note of is that you need to make sure that any adjustment you make to your data while you're cleaning it, you have kept a good record of why that adjustment was made. For instance, if you removed some duplicates, make sure you copy them somewhere else and say this record was removed because it was found to be a duplicate. Kind of have a good note-taking process, because once you've completed the analysis, you might have some questions asked as to why was this removed, or you might have those notes useful while you're doing some adjustments into your database to correct any mistakes. So keep a good note of every adjustment that you make into your original data set. With that, I will hand over to our next facilitator. Is that Chloe?
Yeah, thanks.
Right.
Thanks, Gloria.
Mm-hmm.
Good morning, everyone. So I will take you through some of the steps for cleaning your data. So we've already talked about what data we need, and we've already talked about the fields that you need to have in your data. And you can also find this list in the email that we sent out last week with the data that you need in your data set. So one of the first steps of cleaning your data, which is perhaps the most important, is to ensure that your data is set up correctly. And this means, as Gloria mentioned previously, not working on your original data set, because sometimes mistakes do happen, and it's important to have your original data source just in case. So you can copy and paste your data into a new Excel worksheet, such as the one shown in this screenshot on the slide. And every record, or by record, we also mean every person in the data set, should have their own row, and there should be one field per column. If your data isn't in this format, you will need to reformat it. And when you copy your data into Excel, just make sure that all the data is copied over from the original source. And you can do this by checking that the total number of records in the original data is the same as the data set copied over, just to double check that all the data has been copied over. And if your data set has any blank rows or columns, these should also be removed. It's not uncommon to find duplicate records in large data sources. This may occur due to random reporting error, for example. And in Excel, we can check for any duplicate records and then assess whether to delete these records based on whether they match with other records in your data set. We can use Excel to match records in our data set, and it's important that records be matched on at least 3 of the following criteria as shown on the slide. This example applies to death data, but we can also apply the same method on birth data. For example, we can check the duplicates in birth data by finding records which match on name, surname, and date of birth. But an important caveat here is to make sure that you're not removing twins, which could appear as duplicates depending on the fields you use to match records. And we will be providing you with an example of using the Excel sort function to find duplicate records after this webinar, and we can also go through it together during tutorials. So one of the next important functions of cleaning data is to ensure that we have all of the relevant data in our data set for calculating vital statistics. This includes irrelevant data such as stillbirths, which is also important data, but it should be included in a different file so as not to be used in the routine birth statistics. Step 4 is making sure that your variable names and data labels are consistent, because it makes it much easier when you come back to aggregate your data later for producing vital statistics. For example, error may have occurred during data collection or data entry that led to a value being recorded incorrectly. And if this isn't corrected now, these records may be excluded from analysis later on. So using the example of date of birth, we need to make sure that date of birth is recorded in the same format for every record. For example, you might find that for one record, it was recorded in the format day, month, year. For another record, it might have been recorded month, day, year. So we need to make sure that it's all in the same format. And we can use the Excel filter function for this. And again, we will be providing you with walkthrough demonstration slides after this session on how to do this. And step 5 is dealing with missing values. And another important part of cleaning data is checking for these missing values. And after we have located missing values, we should see whether this data is available from an alternative data source. And this may mean that you need to combine 2 sources of data, such as civil registration and health data. Other methods can also be used to assign values to missing data, such as using the information readily available to us to compute a value. Data can also be imputed, and missing values can also be redistributed following the distribution of recorded values. So we will be going over all of these methods at later points during the course, and we can also go through them during tutorials as well. So now that brings me on to the most exciting part of this webinar, and Elise will be taking us through a live demonstration of some of the useful functions that you can use in Excel for cleaning your data. Does anybody have any questions before we move on to the next part of this webinar? You can feel free to shout out or type your question in the chat box. Okay, so in that case, I think I can hand over to you, Elise, but if you have any questions that pop up, please just feel free to write them in the chat box too. Thank you.
Thank you, Chloe. So yeah, I will take you to some Excel. Can you see my screen? Wait.
Yes, we can.
Yes.
Okay. Yeah, so for the assignment that we will give you this week will be to make some tabulation, clean data that you hopefully have. And to make those tabulations, there are a few functions in Excel that are very useful. So first, when you have your Excel spreadsheet like this with the record data, so as we've said, it should be in this format, which is 1 line per record and like separate various proper names that you can understand. Top left, you don't want empty columns or rows at the beginning. So if you have on the rows, you can delete them because it will allow Excel to function a bit better. The sense of your data is to sort your different your records by variables. So for that, if you go to the data tab that is on the top there,
Please, sorry.
You will find. Yeah.
Yeah. Could you maybe turn off your camera? It's sometimes cutting a bit your voice.
Okay. Yeah, so you have a data tab at the top, and if you click on the filter button that is in the top middle, then you will see those arrows appearing on all of your column names. And then from those arrows, you can click on it, and you can have those sort functions that are available. So in this case, so here we have the year of birth, but in my data set, that's all the same year. So we can sort instead by the month of birth. Yeah, so here by sorting the month of birth from smallest to largest, I got the record in order, like here is January, and then if we go up further down, we'll see February, that kind of things. So if you sort the different variables like this, you might get a better sense of what is your data, and it can also help you for the data cleaning tips that Chloe just gave you. If you have to look over them and you start seeing by sorting, you can start seeing some duplicates with some identical values for several records. But again, for the details on how to properly do that, you can reach out to us and we'd gladly help you for how to do that. And then once you get a better sense of your data and of the different variables, you can start looking into how to make some tabulations. So for that, you would go here. You can see on the top left the Insert tab, and once you're in there at the complete left, you will find a pivot table button. So if you click this pivot table, once you're on the spreadsheet with your record, it should normally select all of your table. Again, you should then have deleted like any empty rows or columns. So once you have this selected table, you can just do OK. And now we're taken to a new sheet. So here on the left is where the tabulation will actually appear. And on the right is how to is the tool to build that tabulation. So here we have the list of the different variables that we have. So that's why it's important to have a good headers on top of your column so that you understand the names of the variables that you're tabulating by. So to start with, one of the first tables that we'd ask you to do is to tabulate the number of births by year. So in my case, I just have 1 year in the test data that I have, so I'll tabulate by month instead, but it's the same. So I can first select this month variable, and then I need another. I need to select another variable for Excel to properly tabulate, and this can be any variable if it doesn't have any missing values. So you need to choose a variable that it can be about anything, but it just needs to have a value per each record, so that then when Excel counts the number of records, it doesn't miss anything. So in this case, I can choose this this variable. But as you can see here now, we on the left, it doesn't look like anything. To actually shape how the table is going to look like. So for the default variable that we want to choose, we can put it in the value here at the bottom. Oops. And for the values, for the variable that we want to tabulate by, so month or year or anything, we can put it either in rows or columns. In this case, it doesn't really matter. It's more of a formatting choice. So if I can just put it, take it there and drag it to rows in this case. And here on the left, you can see that we have a tabulation. So here, those are the month numbers. And that's just a number of births by month and the total down there. So there, you can,
sorry, can I intervene? I don't know whether it's just me on my side, but I'm not able to see any change in the pivot table. Like, I'm not able to see the new table you've created. Is that just on my side?
Really?
Is everyone else able to see?
I can see it.
Okay, sorry.
Okay, so I hope most of you can see it. Then you can, to make a bit more sense, you can format a bit by putting some proper names. So here we make the legend of the table, so to say. So you can change the values like this, and with this relatively simple tool, you can tabulate your record data by any variable, and you will obtain a table like this that is clean, and you can yeah, then you have what you want to have. So you can then observe some trends. So in this case, I did for a month, but if you could do it, since I think all of you would have records for several years, you can tabulate by year, and you can start seeing some trends in the number of births that are occurring each year. I don't know if any of you have any question. Okay. Okay, I don't see any question. So I think I will go to the next step in pivot tables, which is quite similar. But so here, as you've seen, we've tabulated by one variable, which is in this case month, or it could be years. But what is interesting with pivot tables is that you can add several of those variables to get some slightly more complex tabulations. So in your case, what we would be asking you to do for this week would be to tabulate birth by year and sex to have the number of each year the number of births that are male or female. So for that, again, we do the same thing. We go to insert. On the left there, we have pivot table, and we can add this table, and it will create again a new sheet. Have again the same appearance on the screen, where the table will be on the left and how to shape it on the right. So again, as I've said, I'm going to select month because I only have 1 year in the test data. So up, that's the month variable. Then I can look for the sex variable. And up, it's added. And there I can add the third variable. We again need a variable that doesn't have any blanks, so that Excel can count how many records are in each of the categories. So I'll choose the same ID variable. But again, we need to look at the 4 boxes below to actually define how it's going to look like. So I will put the ID in values because that is what we are counting. And then the month I can put in rows. And the sex I can put in column. So when you take two variables, you can put one in rows and one in columns, so that it creates a result like you can see on the left that you're probably used to seeing in some demographic reports. So there you have something that is again a bit more complex, but is very not difficult to create, and I hope you can see the table. And yeah, and here it's tabulated, so you have here the number of births in January and the number of those births in January that were female births, and the number of births in January that were male births, and all the way down to all the months and the total down below. And again, we can edit a bit for it to be more readable. And then once you have those tables edited, you can simply copy them. And if you're using, for example, Word to present if you're using Word to present your results, you can just copy this table and paste it in Word, and it will just show you it as it is. And yeah, that's it. And you've got a tabulation. So that was it for what I wanted to show you. I don't know if anyone has a question.
Thank you very much, Ulis. I just want to. I noted that one of our participants dropped out, but in the meantime, anyone who has a question, There was a question from Vanuatu earlier asking about how we deal with missing data. But before we get to that, do we have any questions in regards to the presentation that Ulysse just made on how you tabulate your data? Okay. It looks like there are no questions in that regard. All right, then maybe let's go back to the question on from Vanuatu about how do you deal with missing records or missing data. So Chloe had mentioned or had gone through that through her, as a part of her presentation, where we said if you have missing records, sometimes you may be able to fill out those missing data elements from another data source. For instance, you might not have it in the civil registry data set, but you might have it in the health data set, or maybe even in the census data set. However, if we entirely don't have the record, then what is important is to just make sure that we have correctly labeled it within the file that is a record for which the data is missing. So you can use terminology like missing record, or any other word that you think will be easy for you to remember that this indeed refers to a missing record, or blank, something like that. So yeah, that's the idea. And in the other modules, we will also deal with how we probably can redistribute variables such as age of mother or age of the deceased in cases where it doesn't exist for one record, but it exists in other records. But in the simplistic way, in terms of individual records for which a particular field is missing, the correct way is to just ensure that it's correctly labeled as a blank record. So maybe Chloe or Ulysse, do you want to go through this slide again?
Sure. Thank you, Gloria. And thank you, Elise, for that useful demonstration as well. As you can see, Excel has some really useful tools for helping you to clean your data. And we know it can take some time to get used to Excel if you haven't really used it before, but we will also help you with this. And we can go through any of the steps that we talked about today with your own data in separate tutorials. So this slide just presents some of the indicators that we hope to be able to produce by the end of the course to be included in your vital statistics report. Which leads nicely onto the assignment for this week, which is to continue cleaning your data using Excel, and also to produce 2 basic tabulations, if you can, of birth by year and birth by sex. If you have time, it would be great if you could also produce deaths by year, but we understand it may not be possible, so it would be great if you could just stick to birth. And if possible, it would be good to have these assignments before Thursday this week, so that we can take a look before the next session and we can go through and work out any problems. And I think that brings us to the end of today's session. I don't know, Gloria, if you want to add anything, or if there are any questions from the floor.
Maybe just to say that if there are any participants who feel like they would want to go through or get further support on any of the things that we covered today, you can just write to us an email and we can organize to support you through something, you know, either going through a particular slide with you, or just helping you through a particular part that is not clear. So please feel free to write to any of us at any point where you feel you need additional assistance to be sure you're clear with what we are doing.
And we'll also be sending the slides after this session and the slides will have some additional information with practical demonstrations of using these functions in Excel with screenshots so that you can go through them yourselves as well.
Yeah.
So,
and do we? I made a screenshot of this. Yes, we can see. Yeah. Thank you so much, Pim, for that. And yeah, I just want to invite anyone who has any comments to make. I just hope the presentation was clear. And yeah, please feel free to engage with us and to give us a shout out for anything that is not clear. But if not, then yeah, we will close the session and we will meet again on Monday for module 3. And in between, we can meet with you at any time for to work with you further.
thank you everyone for joining. Oh, there's one more thing that I also wanted to mention is that the meeting invitation is a recurring invitation, so you won't necessarily receive a separate invite every week, but you will join the same meeting room as the previous week. But you should also receive a calendar notification. But just let us know if you have any issues joining the call and we can forward the invitation to you again. So thank you very much and have a good week, and see you next Monday for our 3rd session. Bye-bye.
Bye-bye. Thank you.
Thank you.
Bye.